Welcome online, everybody. Although we have a small group, I think there's some new people online, some people that are less familiar with EVPA. So I'd like to start with introducing myself and introducing EVPA. My name is Martijn Blom. I run the Impact Investor Network at EVPA. EVPA is a network of about 300 investors for impact all through Europe. Very diverse network of organizations, from very small to very big organizations related to corporates and investment funds set up by very passionate very passionate people, but they all kind of align on providing financial and non-financial support to social entrepreneurs. As I mentioned, within this, I lead the Impact Funds initiative, which is basically a community within the community of impact fund managers, which is about 20% of our members. So around like 60 of our members are actually impact fund managers. And they have very specific challenges and very specific opportunities that we address in this gremium, in this initiative within EVPA. Think deals, think portfolio management. We had a big research on talent last year. One of the biggest topics that really sets fund managers apart from the other organizations in our network is fundraising, of course. How can the organizations fundraise themselves as funds? So we have a lot of pilots going on that are in that direction, but also some sharing online in the podcast that I thoroughly recommend and are openly available for everybody. One of the most important things that we do at EV and what we are doing today is our deal sharing events, where investors from our network share their most promising deals that are looking for co-investment or follow-on investment with the community, so we can help them kind of engage in the conversation around how can we find these co-investors for a certain deal. And today we have lined up two great companies that are with us online already, Braintrip and Dot Glasses. But before diving into these two companies and before presenting them to you, I'd like to invite to stage as well Christine Kandelaki from Georgia, who I've been working together with now for a while. Please join us here, Christine, who we have been working with together for a while now in helping to set up a fund in Georgia. And I gladly hand over to you, Christine. Can you tell us a bit more about who you are, what you're doing, what the organization you work for, and of course the fund? Thank you.
Thank you, Martijn. Hello, everyone. I'm Christine from Georgia, Tbilisi. I represent Georgian Civil Society Organization, the Center for Strategic Research and Development of Georgia. And I'm there the manager of the first impact fund in Georgia named Actio. And I'm also the project manager of the Collaborate for Impact project. Within the project, this project supported the creation and establishment of our impact fund. I will shortly present the concept of our fund and what we are doing, and after that I would be glad to answer your questions. So please share presentation, and I will begin. So I will shortly tell you more about CSRDG, the founder organization of Actio, the Impact Fund Georgia. CSRDG was established back in 1995. So I will wait a little bit. Yeah. So CSRDG was established back in 1995, and maybe you can click the presentation so that I can change the slides. And since that, we've been working on development of good governance systems, development of stable and inclusive economic and formation of active civil society in Georgia. And this everything happens for the welfare of Georgian citizens and Georgian society. I can't. Yeah. So this is our way that we went through since 1995. At this moment, we manage several big programs, and these are our strategic programs and that we work on for a permanent basis. I would concentrate on 3 programs. Since 2004, we started working on development of corporate social responsibility in Georgia. This was followed by development of and introduction of the concept of social entrepreneurship in Georgia in 2009. And after that, we were thinking about the ways of making the lives of social enterprises more sustainable in our country. And in 2016, we met EVPA, and we got introduced to the concept of impact investing. And after several years of elaboration and thinking and discussions, in 2021, we began to work on development of impact investing concept in Georgia. And now we are here, and we established our impact fund. It is the first impact fund in Georgia, and so I will make the short introduction of our fund. So what were like prerequisites of establishment of the fund? In our social entrepreneurship program, we work in several directions that are presented on the slide. I won't go through all of them, but one of the main challenges that social entrepreneurs have in Georgia is access to finances. We don't have any like legal definition of social enterprises, so they can't really participate in governmental programs. It's also hard for them to participate in some private initiatives supporting SMEs. So this was a great problem that we've been trying to solve for several years. There are also other challenges in Georgia, societal challenges that could be tackled by social enterprises and social entrepreneurship. And we see that these social and economic challenges could be really solved by social enterprises, or social enterprises can really contribute to solving these challenges. Yeah, I don't want to speak like very long, so maybe I will continue to the fund, okay? So we saw that in order to make lives of the social enterprises easier, in order to increase access to finances, and in order to create some sustainable source of financing local social enterprises, we saw that this impact investing and impact fund is a very good tool for that. So our impact fund, Actio, aims to create to develop social economy in Georgia by supporting social enterprises that already have proven business model and proven social impact. And we support these social enterprises to scale up in terms of finances and in terms of impact, of course. And for the next 5 years, we aim to support 10 social enterprises with our funding and non-financial support, of course. We have several directions, like several spheres we will contribute to. This is work integration and education, environment protection, and culture development and preservation of cultural heritage. We will definitely work using venture philanthropy principles. So this is the impact-only fund. For the start, we decided that this would be more tailored to our context to have the impact-only fund. So we will support social enterprises from 3 up to 5 years, and our support will include financial support with smart grants, milestone-based grants, and also loans, zero-interest loans. We will definitely have a capacity building and non-financial support for social enterprises, and of course social impact measurement and management. This latter one is extremely important because in Georgia social enterprises really lack resources, skills, knowledge about planning, managing and measuring social impact, and we are very eager to support them in doing this. This is the short information. I think we will continue our conversation with Martijn, and if you have some questions, I would be glad to answer. This is my contact if you would like to contact me if you're interested in our fund.
Great, thank you, Christine. Let's sit down on the couch while we continue the conversation. Before I open up to some questions from people in the room, can you give an example? What do we need to think of when you're talking about social enterprise in Georgia?
Mm-hmm. We have a very diverse spectrum of social enterprises. There are enterprises providing social services, enterprises aiming employment of people with disabilities or from other disadvantaged groups. For example, there is a very successful social enterprise, Dadari. It aims integration and socialization of people with disabilities as well as internally displaced people. And it produces wooden toys that are very beautiful and also environmentally and eco-friendly. And they sell these toys locally also in Georgia, but they have partner organizations in Europe, in Germany, for example, and this is one of the social enterprises that has already exported their products. And at this moment, they have about 15 employees, and about 12 people are from these disadvantaged groups. And one of the their greatest social impact is that these people now have their own income, have become more independent, they have their community, friends, and they feel more like self-realized. And yeah, I wish that Dadari could scale its impact and its work like in Georgia and in other countries too.
Great. Are they one of the companies that we've covered in the short movies?
It's one of the companies that we've covered in the best practices in the case studies. So you can go to the website of Collaborate Impact Project and you can find the case study about Dadari there.
Yeah, if you Google on Collaborate for Impact, then you'll definitely find the website. I know there's more examples of ventures there from the whole region actually, and also this one. So nice to learn more. What are the challenges that you encounter as the first impact investment fund actually in Georgia? In setting it up, in what is the main challenge you see now also for the next couple of months?
So one of the biggest challenges is that the impact investing is a very new concept for Georgia, and when you start talking about it to anyone, you have to make like very long explanation speech about the concept and about so what it means. It is a challenge, but it is an opportunity also for us to have more like educational, informational activities. Consequently, the challenge is also to attract investors because they also don't really know what the concept is. It is a challenge for them. For some of them, social entrepreneurship is still a new fruit. And when you talk about both social entrepreneurship and social impact investment, sometimes it blows your head. But still, we see we try to see it as an opportunity, and we already have some achievements towards attracting impact investors, so we are very optimistic about it. And one of the challenges is also that we are also beginners. It's like it's the first impact fund in Georgia, and we haven't done this thing like before. We worked in the sphere, but still it's new for us. And we, with our like leader impact investors, are learning in a learning process. And yeah, it is a challenge, but you can't do anything without challenges.
Good. And you mentioned briefly there is an achievement. I know, but can you tell the audience and the camera as well what the achievement is?
Yes, we have already one impact investor committed to support our impact fund. I don't really know yet if I can say his name out loud, so yeah, maybe I will keep it. I don't really know.
There are millions of people watching with us right now, so be careful.
Yeah. So we have one impact investor committed, and we have found several partner organizations that would eagerly support activities of the impact fund, and we are still waiting for 2-3 impact investors to join. They are now like in a thinking process.
Very good.
Yeah.
Very good. Let's convince them over the next few days here in Vienna. Last question, there are investors in the room, there are people that represent investors in the room. We will be sharing this video to our community of investors. How can people in the room or looking at this video later help you in the process?
The first idea that comes to my mind is sharing their experience. We are planning to have many events in Georgia for experience sharing, education, networking, and in order to give opportunity to our corporate sector and individual investors to get more information about the concept. So, and sometimes it's very hard to invite the right people to Georgia. So I would appreciate if you come to our country to share your experience and to talk about the good sides of impact investment. The second thing is if you are interested in Eastern Partnership countries, specifically in Georgia, and if you would like to invest in our fund, the doors are open. At this moment, we have an opportunity of investment for impact investors. It's about $25,000 for a 5-year round of our fund, and with this contribution, we will be able to support development of 10 social enterprises, and we will support to scale up their social impact and business. We offer to our impact investors, of course, this we have very long offer for our impact investors. I don't know if it's relevant to talk very much about it now. However, we can make a little or long conversation about it a little bit later. Yeah.
Great.
Thank you.
Great. So if people are interested to join, please contact us, and we'll connect you to the right people. Like I said at the beginning, I think we can open up for some questions by the audience. Don't be as intimidated as we are, at least as I am, by this studio setup. There's people in the room. Are there any questions for Christine from people that are calling in? That's not too much. Come on.
Maybe the question could be if I mean Georgia the country or Georgia the state.
Well,
so it's the country, definitely the country.
Nobody there with a small question? No? Okay. Then, Christine, I thank you, and I hope we'll reach some interest from the people watching, or from the people watching after the session, when we will be sharing it on our communication profiles. And thank you for this presentation, really clear, and good luck with all your efforts.
Thank you very much.
Thank you.
Thank you.
Then we can go to the next round, and I'd like to invite someone to the stage for who all this setting up a fund, being the first fund in the country, invest in social entrepreneurs, must sound familiar, because you've been active for quite some years already in this industries, and you already have first companies that have made it to this next level, and that we will also be sharing later on stage. So can you please join me on stage, Silke? And tell us a bit. Hi, Silke. Can you tell us a bit on who you are and what your organization does, what your organization is, where it's based, and then.
Right.
Please.
Yes. Well, my name is Silke Horáková. I'm based in Prague, Czech Republic. I co-founded Tilia Impact Ventures in 2018. It was actually one of the first social impact funds in the CE region. It was intended to be a pilot fund. We wanted to start fast, so it's a small fund. We have 2.5 million euro under management at the moment. It was mainly aimed at creating awareness in the investors community, among the founders, and we are now in the process of raising a larger fund of 25 to 30 million euro, which will then focus on the entire CE region. At the moment, we are doing small tickets up to 200,000 euro, investing in seed capital. We have done so far 5 investments. One of them we are going to introduce. And we are looking at 4 impact themes in terms of investing. The first one is transparency in society and social inclusion. Second one is innovation in education. Third one, environmental protection and sustainability and production and consumption, with a strong focus on circular economy. And the last one is healthcare and well-being, with a strong focus on disadvantaged groups. And here belongs this project, .classes, we are going to introduce in a minute.
Great, Silke. I think this is truly an inspiration, and also like an example for the funds that are now being set up in countries like Georgia. Also starting as a pilot fund, and then people don't know where it will end. But it's good to see that where it's going with your organization, because you're really established right now. It's far from being just a pilot. It's a factual fund with results and companies, right?
Yes, that's amazing. And most important, we have investors who support us from the very beginning. We have more than 20 investors actually invested in our fund, and a large group of them will go with us to the next fund. So it's always important to gain these private investors as well, not only public money.
Very good, and I fully agree, I would say. Let's move over to dot classes then, because I'm really curious to hear more about it in a minute. But why did you as an investor invest in them, and why do you propose them right now for the deal sharing session?
I met Philip, who is the founder of dot classes, Actually, many years ago, we were serving on the same board of a telecommunication company. Philip has a great and extensive business experience from leading management positions, but also as an investor and mentor in the startup sector. He is highly impact-driven, which is really reflected in the business model he has created and the partnerships he is seeking, both really focusing on the bottom of the pyramid, supplying eyeglasses. With a very innovative idea. I was fascinated at the beginning by the simplicity and greatness of this idea, which makes it possible to assemble on the spot these glasses. And I think Philip will tell us a little bit more about this product and his amazing new venture. So, and in the meantime, they have really established a great sales organization in 12 countries in Africa and Asia. And they're raising now their second round of financing, which is a seed round still. 2 years ago, we were the lead investor in a pre-seed round of 1 million euro. Now they're raising 1.5 million. And more than half of this has already been committed. So we would welcome new investors in this. And I think we should hand over now to Philip.
I think so too. I'm really curious. Philip, are you there?
Yes, I am. Hello, hello.
Great. Can I ask you to there you are. Great to see you there, Philip. I gladly hand over to you to introduce yourself and your company and to take it away in the pitch.
Very good. Thank you so much. Let me just screen share real quick, and then we can jump right in. Smaller here. There we go. Can you all see that? Okay, I'm assuming you can see that and still hear me. So thank you very much for inviting me. My name is Philip Stalen. I'm the founder and CEO of Doc Glasses. Silke, thank you very much for the kind intro. So over 1 billion people in the world see something like this. Even though there's been a technology around for over 700 years that deals with exactly this issue. This is a massive global health issue, but until just recently, no one talked about it. So it's 1 billion people that suffer, but only in the last even 6 months there been some general recognition. This is a big problem. The United Nations General Assembly just passed a resolution about 5 months ago that vision for everyone by 2030 is a goal worth pursuing. This is a wake-up call for countries around the world. And of course, that's very important for us as well, because awareness of the issue is an important starting point. Because we all know that without glasses, you can't learn. And without glasses, you also cannot earn. So our solution solves 5 key legacy model issues. These are things that these 5 elements need to be perfectly aligned in order to serve the bottom of the pyramid in a sustainable and scalable way. So first of all, distribution complexity. It's very challenging to reach poor people in even urban settings, but also especially in remote villages. That's something we had to figure out. Training, it's important to figure out how to train people to measure vision, but also then deliver the glasses. And end-to-end costs are super important. It's not just the unit cost, which is usually the headline of the companies addressing the space. And style, many companies that have come before, it made people look more like a science experiment than anything else. And no matter how poor you are, you still need to look good. We have to address the style issue. And then of course, in the markets we're in, the glasses have to be robust. These markets are very, very challenging, and the glasses have to last. But it's a problem worth solving, because over $250 billion are lost each and every year due to lost productivity from poor vision. The good news is that if you add glasses to the mix, you can increase worker productivity by 30%. Monthly income levels will also rise, and the positive economic impact from $1 invested into glasses is $25. It's a fantastic investment. So why has nobody cracked this to become sustainable and scalable to address this issue, which is obviously a big issue which solving has big impacts? Well, many have tried. Some of these are still around, some of them not, but it's because no one has figured out how to address all those 5 issues at once, which is very important, until Doc Glasses. What did we do differently? Why did we accomplish what others couldn't? Well, we chose a very different way of approaching this problem. We chose a consulting 80-20 approach of the Pareto principle, and we combined that with that startup mentality, the minimum viable product. And we came up with something unique. It's the good enough vision. So that means getting people to within 0.75 diopters of their perfect vision. We're not striving for perfection because perfection is extremely costly. The style, of course, is good enough. I'm wearing them myself, as you can see. Most people couldn't recognize that they are costing about $2. The frames themselves, they're the world's first adjustable one-size-fits-all frames. And they were designed actually by a design subsidiary of Mercedes-Benz. And the lenses themselves are also quite interesting. They're agnostic. So the left one can fit in the right side and vice versa, which is immediately cutting stock in half. So what we came up with is what you see on the left-hand side. It's glasses in pieces that snap together on site. It's 6 pieces of ABS plastic. It's the same plastic as Lego is made out of. My kids tell me it's indestructible. I tend to believe them. These pop together in 45 seconds, and then you pop in the lenses on site. The design actually won the Red Dot Award in 2020. And then we have vision testers, that middle picture. And we have 2 of these in every kit. One's for nearsightedness and one's for farsightedness. And included in the device is also a pupil distance measuring tool. So we can get the pupil distance correct. This is another important factor for providing better vision. And then on the right, you see the key elements of our distribution model. There's the micro entrepreneur kit, the vision kit. These are optics shop in a bag. So that small kit contains 20 frames, 60 lenses, and all the tools needed to start measuring vision and delivering glasses. And it weighs like 2 kilos, smaller than a laptop bag. So ultra portable and actually indestructible. You can stand in this, doesn't do any damage. And the big kit is for vision camps to serve more people in a given event. Now, what we've done is we've turned the traditional vision care industry on its head. So instead of 3 customer visits, 2 to 3 week delivery times, and everything being very complex and costly, we require 1 customer visit. Vision testing and delivery takes 2 to 3 minutes. And we've kept everything as easy as possible so that we can actually leverage existing infrastructure to deliver glasses to those that need them. So this is a short video about the assembly process. It's only slightly sped up. I remember in reality, it takes about 45 seconds or maybe even 30 seconds if you're getting used to it. But it's very, very simple to pop this together on site and then adjust it properly for everybody's head shape. Now, our channels to market are various. Again, what I mentioned before is we like to piggyback on existing networks. So that means if an NGO has a field force, we can actually train that field force in 1 hour to actually start delivering basic vision care. But so NGOs is one example. The government entities, healthcare or education ministries are obvious customers of ours. Commercial channels, including pharmacies or private health chain clinics, micro entrepreneur networks, and of course, corporates such as tea plantations all make great customers. At the moment, we are focusing our efforts more on the commercial channels where we got early traction, as well as micro entrepreneur networks, both existing ones, but we're also starting to build our own. And in terms of our target customers or the end customers, because our customers are actually, we're mostly B2B, but who we're trying to serve with the glasses are students, poor adults, elderly, and people in refugee camps. 85% of our sales do target the poor adults and elderly, and that's a function of the fact that, especially in the developing world, as soon as you hit 40, you actually start requiring reading glasses, much more so than in the developed world, actually. So the customer base for the elderly is simply higher. And our customers are satisfied. So first of all, we always ask, we do surveys, and the quality of life has improved for the vast majority of people wearing our glasses. So that's good to know. It's an answer we'd be surprised if it wasn't the case. But also, they like the visual appearance of dock glasses. So some people say, hey, you only have one style. And we always say you can have any color you want as long as it's black. It's actually not important. People can actually wear the glasses, feel comfortable wearing them, both men and women. And the surveys confirm that. So already we're partnering with some of the largest organizations in the world. On the left, you certainly know many of these logos. And on the right, we always try to partner with local organizations as well. Be it, let's say, M Pharma is a commercial pharmacy chain in Nigeria, or in the Republic of Uganda, we're working with some doctor networks as well. And then there's a mix, but obviously we work both on the global level and the local level. And as Silke mentioned, we're in 12 countries already. We've sold about 85,000 glasses. Now, we were hoping to be a bit further ahead, but of course, COVID completely shut down some of our markets like India. And in the meantime, even during COVID, we were able to build the platform though. And now we're at the point where we're accelerating, which is why we're needing to raise additional funds so we can actually step on the gas. Now, social impact is achieved in 2 ways. First of all, there's a health side. That's quite clear. We discussed that, the benefit of improving vision. It's important for the individual, their families, and also society. But in many cases, even the value proposition for some of our partners is job creation. So by creating micro entrepreneurs or vision entrepreneurs, we're actually helping the community as well. And this is very important, and it's an important part of our strategy. The one dedicated vision entrepreneur can screen, let's say, 300 people per month. They sell 100 glasses, which is 1,200 glasses per year, and they can earn an income of roughly $2,000 a year. Now, if they're typically used to earning $2 a day, this is actually excellent income. Now, our aim at the end of 2022, or by the end of 2022, is to reach 250 vision entrepreneurs in our network. We're about halfway there. And that means if we get to 250, and this just shows this scalability of what we're doing, we can actually start selling 450,000 glasses per year. And with just this 250 people, and then that actually leaves around 750K in the pockets of entrepreneurs as profit. So it's a fantastic business model where we can actually create livelihoods as well as the treating for vision. And we directly influence a number of SDGs. So on the vision care side, it's 6 SDGs. Actually, it's even extended somewhat, but these are the core. And then livelihood creation also contributes to 4 of those SDGs. And in 2020, we actually were the first place winner of a SDG award for the business category. Here's just a few images of what we do and where we do it. On the top left, slightly pinkish one, that's actually from our very first pilot in a slum of New Delhi. I like to show it because it was where we first were able to really show the impact, and people were incredibly grateful. In the bottom right, Assam in India, where we had 250 people waiting in our vision camp, and we sold about 100 glasses during that camp. And then you see us also operating in Africa and elsewhere. And on the bottom left is actually the vision camp kit, which is super modular. So actually you can set up a vision camp to treat 250 people or to test them in about 10 minutes. So we have a lot of great stories to share, but I'm not going to, of course, read through all of them. But I just wanted to share the one on the far right. That's Jerome, the taxi driver in Ethiopia. Next to him is my colleague with the beard. That's Václav. And as they were driving, the taxi driver was complaining that he could no longer read his English book properly or to learn English properly because his glasses were so badly scratched. So during the first traffic light, my colleague measured his vision. By the second traffic light, Jerome got his new glasses. So he was extremely happy, and my colleague got a free taxi ride. So our goal is to make a big social impact. Now, what does that mean? Many of the existing organizations treating vision or vision organizations, they're successful providing 1 or 2 million pairs of glasses per year, which is nice. Actually, our investors would be happy if we reach that level, but it doesn't move the needle actually on the problem. So our goal is to do tens of millions per year. And we believe on the right-hand side, you can see within 8 years, we can have a cumulative impact selling 43 million glasses and growing from there. So our business model is truly scalable and it's truly sustainable. And that enables us to have a different paradigm in terms of growth and in terms of impact. The team is actually very, very global. So a few words about myself. Silke already mentioned it, but I was a corporate guy and a consultant. I was running a $500 million payments company. I was also a managing partner of Roland Berger Consulting for the Czech Republic and Slovakia, and in and out of those spaces. But I've also always been around innovation and startups, as Silke mentioned. So when I had this idea, I thought I owed the world the effort to make this work and have the impact. We also have amazing advisors and investors. So you saw Silke, I'm not going to mention her, but on the far left, you see Dean Butler. He's a founder of Lens Crafters and Vision Express Group. These were already disrupting vision care a couple of decades ago, and he's since then been also very active in other disruptors in the eye care space. But he's actually one of our advisors now, and of course has fantastic insight and connections around the world. But that's just one of many that we really rely on to multiply our impact. Now, I want to just be absolutely clear. We are, of course, a for-profit business. We are impact first, but we need to make a profit to become sustainable and to grow. And there's a clear path to profitability in what we're doing. So we should break even in 2024. And of course, as Silke mentioned, we are currently raising $1.5 million in order to accelerate the growth and get us through to that break-even point. That's it from me. I appreciate the interest and would be very happy to answer any questions if you have time for that.
Super. Thank you very much, Philip, for this comprehensive presentation. I definitely have some questions, but I would like to provide the opportunity again to the audience first to open up with questions. Anyone? There's at least a compliment coming in from Cecile. Cecile, can you show face maybe, and maybe you have a question? Ah, there you are.
Sure. Running around. No, I'm maybe curious in terms of gender, if you see any trend or in terms of end users. Yeah, that would be my first question.
Yeah, actually it's roughly 55-45 splits, or more women need glasses than men for a number of reasons. It's also just the way the camps are structured, perhaps. But even for a woman who stays at home and is taking care of the family, she needs to sew, for instance. And if you can't see, you can't sew. So you even have a hard time doing some normal manual tasks. But it's also perhaps just the structure of society, and also women are more inside than the men, and it affects the actual eye as well over time. So there's a split. And also in our terms of micro entrepreneurs, we love the idea of female micro entrepreneurs serving their communities, actually. So that's one of our focus areas.
Great, thanks. And do you have a different design for two type of design for women and men, or it's just this one design?
It's these, and they are for women and men. There's a little dot there, and we have a selection of colors you can choose, so you can slightly personalize them. But we do actually, based on the request from the South African government, we made some children's glasses as well. Now these actually fit children technically, but for younger children, then they look a little bit big. So we actually made some children's glasses as well. When we start doing education programs, that's important. And for very small women, especially in India, because of nourishment, there's a lot of very, very small women with smaller heads, and the children's glasses are also an option for them, of course.
Okay, thank you so much.
That was actually one of my questions answered, if the glasses you're wearing were actually the glasses that we're talking about, but of course they were. Silke, do you have anything to add to the presentation, or from your side?
Well, first, hello to Cecile. I'm glad to see you, Cecile. She is a member of our advisory board, just to say. But it brought me to one point which I would like to mention, which is interesting. Dot Glass is one of the rare projects where we can see really that Western European-based impact investors would invest in CE-based projects. The company is headquartered in the Czech Republic and has, of course, impact globally. But we have the majority of impact investors in this first round was actually from Belgium, and an impact investor, a fund, and then there's a group of UK-based business angels, very active. So I think that's also from this perspective very interesting company.
Very happy to see a familiar face indeed, Piet Kolruit, also in your slide deck. So thank you very much. I had a question on. I'm a fan of bottom of the pyramid business models because I think that's where probably most impact can be made, and where the scaling concept of startups is really kind of helping to scale the impact, because it's so embedded in the business case. Because I'm invested myself as well in a company targeting bottom of the pyramid, I also know that, last mile distribution is always kind of the difficulty. I saw something about like these entrepreneurs you're working with, but how do you foresee using the money that you're asking for to kind of scale both business and the impact?
Yeah, so great question. There's a book actually called The Fortune at the Bottom of the Pyramid. There's a lot of money to be made if you crack it. It's hard to crack though, especially those distribution networks, as you rightly point out. So what we're doing in Ethiopia, for instance, we got a grant from the UNDP. It was $40,000 to launch a program, which then had a bit of government involvement. We basically hired 100 unemployed health graduates, not ophthalmologists, not optometrists, just health graduates. And we trained them to become our micro entrepreneurs. And so they're in the market and they're selling so quickly that we actually couldn't keep up with demand. The second shipment, they ordered another 10,000 glasses, was a bit delayed because of that, because they were just doing an unbelievable job. What we realized though from that kind of impetus was creating our own business networks, our own micro entrepreneur networks is not only feasible, it's actually it's a good strategy. So we know, that $40,000, we know actually now we can do the same thing for less money, and we know the ROI for that. So it's, we don't actually want to own the networks, right? So even the micro entrepreneur network, we provide some management, we do the hiring, and then we of course are subsidizing the kits to them, in the initial kits. But in other countries, then we will use a less hands-on approach. As I said, we still think a lot of the scale will happen as we can piggyback on existing networks. School systems, for instance, is a great approach. Or in Nepal, we do a lot of work within the municipalities that have local health clinics, and suddenly they can start providing basic vision care. So there's lots of ways to get to that bottom of the pyramid, but distribution, well, and I have to say, in many markets, what happens in one market doesn't necessarily work in other markets. It's quite surprising sometimes. And it's hard work, but that's what we've been building for the last few years now, and that's also our let's say competitive advantage and our barrier to entry.
And did you consider, or do you have experience in working together with I don't know, microfinance providers, or working together with larger companies that have big distribution networks to get out there, or is that something you consider or have experience with?
So we have some of each, some of both examples, of course. So microfinance, it's something we're tapping into more and more. In India, we are doing a relatively kind of complex program, multi-stakeholders. One of them is a microfinance organization, and that's kind of the proof of that coordinated effort. And our kits, our wholesale cost of the kit is $65. Usually if you want to be an optometrist, just your basic machine costs $1,500. So we're 10x better than that, more than that even. And so it's not a huge hurdle to get over, and a little bit of financing then goes a very long way. We want to do more of that, because also microfinance organizations have access to other players that we can piggyback on. So we definitely want to do that, and that's something that we will continue working on now. In terms of larger organizations, we are we are actually working with Lenskart Foundation. Lenskart is actually a Indian unicorn that has disrupted vision care for the top 30% of the Indian market. And they have a foundation serving the BOP, and that's where we're actually coordinating, well, not coordinating, they're buying our glasses. They did really extreme testing on our approach and the glasses themselves. They're very happy with them. And now they actually want to extend their cooperation to children's glasses as well, which will send them the first batch this month.
Great, thank you. I see there's a hand raised. Bianca Anna, please share your question with us.
Thank you. It was absolutely interesting. I have some question. In my former life, I worked a little bit in India, so I can imagine what you are talking about. Specifically, where maybe I lost something in your presentation, but where you product these glasses, and what the cost of the glasses is, and do you are working about impact? For instance, you sell the glasses now. I understand that you adopt several way of selling it and providing, and you have charities, but also a network, a commercial network, and so on. It depends, but I think it would be really interesting to understand in 2-3 years what changed in the people life, targeting student, women, and so on, and not just some best practices, but to understand the trend. Not easy for us. Generally, we invest on our territory, etc. But I want to know better, because it's really interesting. And in Italy, this kind of glasses I buy 2 weeks ago is almost 500 euros.
Yes, exactly. And You'd be surprised how cheap they can be. So first of all, we manufacture.
Naturally, they are very, very technical, and they have all the kind of, but if I use the pharmacy one, it doesn't kill me. It's not the best, but I can use it. I understand your logic and the way you put the, and knowing India, I think it's great.
Thank you, Bianca. Philip.
Yes. So you asked a number of pertinent questions. First of all, we are manufacturing in China. 95% of the world's lenses are manufactured in China, so it's hard to get around that. But initially, we set up the molds, injection molds for the frames, also in China. We have our consolidation center in Ningbo. So what we are looking at is moving to India. We hope to be reducing the price there, but also, obviously, China is a little bit scary now from the supply chain issues, for supply chain reasons. We're thinking about having, two areas, but India is actually closer to our demand. So both our Indian demand, but also the African demand. It's closer by boat. And of course, for the Indian market, then we wouldn't pay the import duties, because import duties in some countries are actually quite high. So that's something we're looking at for the next 12 months. Within that time frame, we will actually shift, if possible, to India. The price point is $2 wholesale for the frames and the lenses. Now that is it's a very low price, and our margins are not huge, but we actually are moving our gross margin to about 40%. The lenses are actually much more expensive than the frames themselves, but that's also a flat price. On purpose, we said let's have the same price for the big players and the smallest players, because we don't want to penalize the small players. They're trying to address the same issue. That's where our impact comes. Now, of course, if the government buys 5 million glasses, we might give them a very small discount, but we're trying to be very, very flat with this approach. And then I can't remember the next direction of the question.
No, it was about impact, because I think it's really important to not just to have you have to provide a sustainable economical sustainability, but about the impact on people's life, I think it's important to understand not just some cases very interesting, I changed my life and so on, but to have a complete picture with people that has this kind of improvement in their life, and to understand how the impact is in 2-3 years, naturally.
Sure. So actually, impact, on one hand, it's very simple. We're selling glasses and we're selling them to the BOP. So measuring impact is quite straightforward. The impact, if you're talking just about New Delhi, for instance, one of the biggest impacts of improving vision is reducing traffic accidents. 60% of traffic accidents in New Delhi are caused by poor vision. Mind-boggling statistics. So how many deaths are there just from crashes because of poor vision? 10% of students typically need glasses as well. Now, they're not all going to fail out of school, but many of them will, or they just stop going, or they become troublemakers in the classroom, and so they interfere with the rest of the education of everyone else. You give them glasses, suddenly they can participate. I was 9 years old when I was sitting in the back of the class, couldn't see the blackboard. I thought it was normal until the teacher told me it wasn't, and I got glasses. Life-changing. So then, of course, the future impact of me staying in school is huge, tremendous. But also the people, oftentimes people are, they start getting poor vision when they're in their 40s. They start being able to see. So our very, very first customer, Samuel in Angola, he had lost his job literally the day before, and he was, very upset. So we gave him glasses, and within a week he had found another job, which was better than his previous job. So he was no longer excluded from what he could be doing. Otherwise, he would have probably ended up sweeping streets. So
that's great. But what I want to understand, if you think to give some questionnaire, something that you check in 1-2 years to people, not easy. It's really costly, I understand, but maybe a good idea to have a pilot, I don't know, in Angola, in India, and to follow up what is happening. Because these help you to reinforce, to persuade investors on your business model.
So actually we do surveys, but we haven't been around long enough to get the 3-year impact yet. We are also going to be doing an RCT study in Sierra Leone, hopefully, but it's not quite what you're addressing. The good news is, though, that we're not the only one providing glasses to the BOP. So there's been a lot of studies done, and these other organizations which rely on subsidies, like Vision Spring or Sight Savers or even Essilor themselves, they have done massive research, and that's actually why the UN passes resolutions, because there's so much evidence about the life-changing nature of glasses. So we do need that research. We actually have a lot of research. Happy to share,
Awesome.
and we'll follow up with our own customers as well.
Thank you, Philip, for this presentation. And I do agree with Bianca. And I also when you start telling these stories already, I mean, these stories are great, right? They're great for selling. They're great for attracting new investors. So keep sharing them. That the glasses are strong. I think everybody with kids that play with Lego, that ever stepped on them with bare foot, can acknowledge that they must be really strong. So I want to thank you for the presentation. I want to thank you, Silke, for sharing. Are there any famous last words that you want to add to this pitch?
Yeah, I hope some new investors can join us based on this. I think it's an impressive venture to join, and good luck for all of us. And thank you for inviting us and giving us a chance. And thank you personally for your great work on the Impact Fund initiative.
Thank you very much, Silke, and thank you for
Thanks so
sharing.
much.
Thank you, Philip. With that, we've come to the second, or actually I should say by now, the third investor of today. Elmar, please come forward. Like Silke, you've been one of the pioneers in CE. Happy to have you here. I leave it over to you to introduce yourself, your company. You're much better in that than I ever will be, and looking forward to hear from you. I move to this side.
So, hello everyone. Thank you for the invitation. I think the first and most important thing to say that I'm really grateful to EVPA. So actually our impact story mainly begins here in the Impact Hub Vienna. That was my first touch, first love with impact investing. And one of the second or third touch was EVPA. Actually the rhythm, the harmony of EVPA, which was felt during the conferences and during the sessions. So a great thank you so much for EVPA. And hello everyone, I'm happy to see you here. I'm not happy that you are not here in the Impact Hub Vienna, but hopefully on some time we will meet personally as well. Well, I'm Elemér Eszter, managing Impact Ventures, which is a Hungarian social impact fund. As Silke with the Tilia, we are the first in Hungary as well. We are managing two funds, actually, Impact Ventures 1 and Impact Ventures 2. We are managing altogether 21 million euro, and we have a European mandate. And yes, I think that's probably the most important thing.
Great, thank you very much. And also you, like Silke, you are an example to people like Christine and the people in the Eastern Partnership countries that are now starting to set up funds to see that it works and it is possible. And is there any advice that you can give to these organizations from your experience starting Impact Ventures 1, a do and a don't maybe?
So yes, I think first of all maybe listen to your heart. So I think we all in EVPA, in the impact funds in Europe, we are really fall in love with the whole impact idea. So maybe we try to do a little bit more for that because we established an association, Impact Investors Association, which is operating mainly in Hungary, but we have members from many other countries, and we try to spread the idea, impact investing. We try to show to the normal VCs that, hey guys, there is an opportunity for you to convert, to not only to think about the money, but think about the externalities, so the human factor and the environmental sector, and let internalize that, and let try to involve the human and the environmental factor into your business decision and into your business model itself. So I think the main message that keep going. So don't stop, don't hesitate, don't care with the obstacles, just go forward and believe that we are really trying to do something good and be convinced that this is the right way where we are going.
Thank you so much. I think these are valuable tips and almost always valuable tips in all of life. I would almost say follow your heart and don't be afraid of the obstacles. With that, Brain Trip, we have a fantastic company coming up to present. Actually, I was it's a short anecdote. I was sharing the session with a friend, and she's here now in Vienna to join the team, and she's actually was engaging with the Expo 2020 program, and she said, "Oh, Brain Trip is coming," and they were presenting also in the Expo 2020. So. It's already a famous company apparently, which I'm happy to hear. But can you tell a bit more? Who are they? Why did you choose to invest in them? And why are you
maybe
putting them forward?
So first of all, we Impact Ventures has got a beautiful team. So Gergo and the whole investment teams are working extremely hard. They filtered more than 2,600 companies in the last 3 years. So it's amazing. It's a gorgeous work what they have done, and I'm really proud on the whole team. And maybe 2 anecdotes from my side as well. When I was 18, I think I was working for a Parkinson clinic in Germany. You know, with really heavy diseased Parkinson people who mainly has dementia. So I was pretty. So I met with a lot of people, old people, who did not have a chance to use their brain, who I saw that he wants to do something, but he could not. So that's the first anecdote. And the second one, that actually my first startup, which we founded in 2004, was a medical device startup. And we exited from this startup in 2012. It was a great success for Hungary, for me personally, and it was a medical device. So when I met with Brain Trip, honestly, it was two real strong arguments that I know something about the whole dementia problem. From the other hand, I was really successful with a medical device. Therefore, it was really really a laugh for first time as well. So I was really, when I heard the story of the company, when Gergo and the team just started to make the analysis about the numbers and especially about the deep science what the 2 founders are doing, I was convinced. So I think Brain Trip is a fantastic, typical Central and Eastern European type of team with 2 researchers who are really involved in the deep science field of the story, and they was enough brave to go forward and to say, okay, we are not only researchers, we are not only experts, we want to create a financial value as well. So I think in this company we can see clearly that impact and finances go together next to each other, are in-baked part of each other. That is really a good example for our team and for the whole ecosystem as well. So maybe let's hear what they can say.
Yeah, with that I can't wait.
Company.
Yuri and David are on the call. I think it was Yuri. You would lead us to the presentation, right?
Indeed, yes. Thank you.
Welcome, Yuri. We'll sit down.
Let's go.
Well, thank you for the virtual stage, and thank you for giving us the opportunity to speak about our vision. And I'll start with a sobering bit of statistics, and that is that about 50% of the people listening to this pitch will be affected by dementia. And that's either because they get the disease themselves or because one of their close relatives does. Again, my name is Yuri. I'm the co-founder and CTO of BrainTrip, and we have developed the first rapid and scalable screening test for dementia. I'd like you to meet Jane. She's been married for 30 years, but she doesn't recognize her husband anymore. And last winter, she almost froze to death because she got lost in her backyard garden. And lately, Jane's family needs to watch her constantly so she doesn't overdose on her insulin. Jane is one of the 65 million people who suffer from Alzheimer's dementia. But Jane's life didn't have to get this bad this fast. Even though Alzheimer's is incurable, most of Jane's problems do have effective treatments, but these only work best if started early. Jane actually first started to feel her memory slipping 6 years ago. But when she raised concerns about it, her husband and her doctor told her she was simply getting older. But when 2 years ago, she started forgetting her husband's name, her doctor finally referred her to a neurologist who just recently diagnosed her with Alzheimer's disease. Had Jane been screened for dementia when she first raised concerns, she might still be her old self. And early dementia screening is exactly what BrainTrip offers. Our first product is a CE-marked medical device that functions as a screening tool for early dementia detection. The core of our product is a piece of software called the BrainTrip Dementia Index, or BDI for short. The BDI takes in EEG data on the electrical activity of the brain and returns a value that represents the brain's mental abilities. The lower the number, the more likely it is that a person is suffering from dementia. At 88%, the BDI's accuracy is on par with gold standard diagnostic tests, and we have validated our product on more than 700 individuals in 3 separate scientific studies. This is our dementia testing screening package. It consists of our software running on a tablet PC and a third-party EEG device. We sell or lease the whole package to our customers who are senior care facilities, private clinics, dementia researchers, and so on. Now, it doesn't look like much, our package, and that is exactly why we are so proud of it, because it doesn't look like much. Especially if you compare it to these huge brain scanners that take up 3 rooms in a hospital, cost 10 million euros with an additional 500,000 of upkeep costs every year. They require 5 people to supervise them, and so on. So we believe that the future of medicine doesn't just lie with these expensive devices, but also with devices like these, who are small and mobile and non-invasive, can be used anywhere, and most importantly, can actually reduce healthcare expenditures, which is a huge problem nowadays. The big problem with currently available diagnostic tools for dementia is that they're just not suitable as screening instruments for early detection. And that's because they're either too expensive, like the aforementioned brain scanners, they're too invasive, like CSF tests, which require a needle to be inserted into the spine, which most patients really don't like, or they're just too slow, like standard clinical observation. So how do we actually do it? How does our test work? Well, let's say Jane decides to undergo dementia screening. She visits a private clinic or any other business that offers our solution. During the BDI screening, which is based on a short 8-minute EEG recording, Jane merely sits comfortably in a chair and rests. Jane's EEG recording is then automatically uploaded to our servers, where our algorithms process the data and return the BDI score. If the BDI is low, Jane is advised to visit her family physician as soon as possible. If she's within the expected normal range, she's advised to repeat the measurement after a certain time, let's say 1 year. The entire testing process takes only 20 minutes from start to finish. We also have several unique selling points. Firstly, we can predict how fast the disease will progress for each individual, and no other test can do this. The BDI can also be repeated on the same person on a yearly basis to detect abnormalities as soon as they appear. Since EEG devices are very affordable and mobile and completely non-invasive, as opposed to traditional brain scanners, our screening solution is also highly scalable, and it can basically be used anywhere in the world. We also developed our solution to be easy to use so that a minimally trained person with a day's worth of training can do the test. Our data processing pipeline is also not limited to dementia screening. It's actually our long-term goal to branch out and cover other neurological diseases as well, such as depression. We're a B2B SaaS company targeting organizations that deal with seniors. In the beginning, we'll rely on out-of-pocket payments and government subsidies to cover test expenses, but we're also working on a reimbursement code for our test. We already have some traction. Over 15 senior care facilities in Slovenia have taken part in our dementia screening awareness campaign this year. And we've collected over 3,000 applications from seniors wanting to get tested by our system in just this small country alone. One of our market partners is Sincere, a Dutch care network with access to more than 6,000 people in our target group. Holland Health Clinic is a private clinic in Amsterdam that wants to attract more seniors by offering dementia screenings. And Sava Insurance Group is one of Central Europe's biggest health and life insurance companies. What will we actually sell? So we will offer B2B packages with a monthly subscription and a yearly contract. With each package, our clients get a number of pre-purchased tests per month, and the price per test decreases with volume. Our target average package costs about 5,000 euros per month, whereby each test costs about 50 euros. Each additional test beyond those included in the package and costs the same as the price per test in the package. And each EEG device actually has a large testing capacity of about 220 tests per month per device, assuming an 8-hour workday with some breaks. If we're as conservative as possible and assume that each client will only pay about half of our target average package cost, so 2,500 instead of 5,000 per package per month, we can still see that even at these half prices, there is high profit potential, and we can reach the break-even point by mid next year with only 10 packages sold. This is our past and future roadmap. This is our past and future roadmap, and our biggest past milestone was actually obtaining CE marking as a Class 1 medical device in May of last year. Our next big milestone is the start of our commercial service, which is planned for July of this year, so a little bit over a month away. Braintree was founded by David and myself. David is more business savvy and is the CEO, and I have more than 15 years of EEG processing experience, and I've developed the BDI. We also have a great team of developers, data scientists, field testers, physicians, psychologists, and community builders to support our vision and help us along the way. We've obtained several grants. Most notably is the Expo 2020 Dubai grant, which had more than 4,000 applicants. We've also signed 2 CLAs with the accelerators Rockstart Health from the Netherlands and Fast Track Malmo from Sweden. About a year ago, we closed a pre-seed investment round with Impact Ventures and with a Slovenia senior care management company. We're currently looking for partners to help us scale, and we're starting to raise a bridging round for later this year. And we're also looking for investors who have connections in senior care. I'll also include a few testing photos so you'll get a better impression of how our test actually works in real life. We've been doing this for over a year and a half. We have more than 1,000 EEG recordings by now. And for those of you who have your cell phones handy, you can snap a photo of this QR code, and you can also take a look at a short 90-second promo video on YouTube that gives a very nice impression of how the test actually works. I'll stop here and I'll thank you for your time and open the floor to any questions you might have.
Thank you, Yuri.
I'm so proud. I'm so proud, guys.
Thank you so much.
Thank you. Thank you for this pitch. It was really a very good and comprehensive presentation as well. I definitely have some questions, but first let's put it over to.
No, maybe what you can maybe clarify that you are providing a hardware and the software, which is itself is enough to do your screening process, or you need an EEG device as well. What is exactly the product?
So our core product is a piece of software, right? But this piece of software runs on a tablet PC, which is a third-party device, and we provide this with our package. And we also provide a third-party mobile EEG. So if a customer who doesn't have an EEG device, isn't a hospital, and just wants to do our dementia test, we can provide the whole package. A third-party EEG device, a third-party tablet with our software. So they get the full package. If a hospital contacts us and say, hey, listen, we already have an EEG device and our people know how to use it, can we just use our software? The answer is yes, you can, because our software is agnostic to the EEG. We can work with any EEG out there.
So you need an EEG device, but it's a device agnostic type of software what you provide. That's okay.
Yes.
Do we have any questions from the audience? Ricardo, I see hands up.
Hi, congratulations, Yuri. Great pitch, but also more importantly, great product and great software. First, I want to apologize to everyone because I don't have my camera. I couldn't get it working even after 2 years of Zoom calls. I know it's that bad, but Yuri, I wanted to ask you a question in the sense that the medical screening is still necessary, right, to diagnose and to treat the patient. So my question is, in terms of that, how does the brain trip simplify the process? Is it just mainly trying to avoid overflowing the hospitals and the detection? What's the angle there that you're trying to get to?
Yeah, thanks for that. That's a great question. So where does brain trip fit into the existing flow for someone with dementia? And the answer is, the current problem with dementia is that while there are diagnostic tools like brain scanners and CSF tests and so on, you cannot use these tools to pick up the disease early on, because these tools are confirmatory diagnostic tools. You already need to suspect with a great degree of probability that somebody has dementia in order to justify a brain scan, which can cost 3,000 euros, or a CSF test, which needs a needle into the
one
spine.
treatment costs 3,000 euro.
One PET scan to diagnose dementia can cost 3,000 euros. That's why nobody orders them. So these are theoretical options, right? A CSF test is more affordable. It's 400 euros, but you need a needle in your spine, and about 30 to 40% of patients say yes to that. So the problem physicians have is that they don't know when it makes sense to use these tests. That's the first problem they have. The second problem physicians have is that they're overwhelmed, like you already mentioned. They are overwhelmed with patients that think they might have dementia, but really don't. About 2/3 of people who get referred to neurologists don't have dementia. They're what physicians like to say are the worried well. So people who are just worried, but they don't have dementia, but they're clogging up the medical system. So that's what we want to address. We want to make the lives of physicians easier. We want to deburden them by basically screening people for dementia with a cheap, handy device that's non-invasive, no needles, no radiation, and only funnel those people who actually likely have dementia to the medical system, where they will get diagnosed and and treated early on, because that's the second key. So not only do we want to save on medical expenses and unnecessary tests and deburden physicians, we also want the people who actually have dementia to get treatment as early as possible. And the only way to get early treatment, and people who treat cancer know this very well, the only way to get early treatment is to get early detection. And that's what we're trying to do.
Great, thank you. My wife actually is a GP, and she gets completely frustrated about all these people coming in wanting to know if they have something that they read about on the internet. So if you have like this quick testing that could really work out, I don't know, so I need to check with her how much questions on dementia she actually gets. But that's I can see where the added value is. My big question would be, knowing about the medical industry being really conservative, being really going for what they know rather than going with something new, how do you aim to launch into this sector? What is your plan of action?
Yeah, thanks for that. I know all about the medical system being conservative. I actually studied medicine, and it's good. It's good that medicine is conservative, and you know why? Because there are many more ways to hurt a person than to help a person. So medicine needs to be conservative, and we welcome that. So here's our plan. We need to convince the medical system that our test works, and we do that by doing scientific research and publishing papers. We're already doing that, and we'll continue to do that. Secondly, we need to have a soft entrance into the system, and we've done that in Slovenia already, and our soft entrance is basically offering preventative screening for dementia for free, based on sponsorships by a variety of actors, state insurance companies, and so on. And then once physicians get to know our test, because they've seen the papers, they've gotten patients who've gotten screened via this test, then they will begin to see the applications. And thirdly, what you need is insiders, you need spokespeople, you need key opinion leaders in medicine to basically push this. As reluctant as the medical system is, you sometimes need to push it on them at medical conferences. And we're also in contact with key opinion leaders in Central Europe that will do that for us.
One additional information, what is extremely important, that if you can recognize, if you know that anybody or somebody has got an early dementia, then there is some solution to help them. Luckily, the leader in our team, in our investment team, he's a great GP guy, but he's a psychologist next to that. So he clearly knows that if we detect that this patient has got an early dementia, there is solutions. If he's reading enough, if he's doing Sudoku or something like this, he can postpone the real symptoms of the dementia, and this solution is an extremely good solution, for example, for insurance companies. So they are not only hospitals, but insurance companies will be happy to buy such a solution, because they can put in his product this type of screening, and certainly so the price of the insurance could be modified with this factor.
Great.
Yes,
thank you so much.
That's a great point. And actually, we've done some calculations here. And the only thing worse than a person with dementia is a person with undiagnosed dementia, because a person with undiagnosed dementia doesn't get treatment, doesn't get help, and ends up costing the health insurance much more than a person with dementia that gets treatment. So that's actually a cost-saving measure. A person with dementia who doesn't get treatment is more prone to falling, to getting into car accidents, to having a heart attack or stroke because they're not eating right, they're not taking the medication. So health insurance companies are recognizing they're actually paying for a very cheap yearly exam for dementia is actually cost effective for them.
As you pretty much see, that the team is in love, is passionate about the whole solution.
Yes, definitely, very much so. We can see that. Thank you, Yuri. We're coming almost to the end of this session, and I would like to close off, Yuri, with one last question, and ask you to give a very short answer to it, or maybe I should ask David, as he was introduced as the business savvy person of the team. It's like, what are you asking from investors? What are you looking for, and what do you have on offer as a last question?
What we're looking in investors is basically what Impact Ventures offered. So someone who knows that that developing such a medical solution takes time. That that the market entry can be a bit slower than with usual startups, and an investor that can help us connect to potential markets, that can help us raise future rounds. So we're looking for someone who's on board for like the long haul, not just someone in the next round, but someone who's willing to support us along the way.
Thank you, David. Thank you, everybody, for being in this call. We will definitely send this recordings of part of these recordings also to the investors that couldn't make it today, because I think today really deserved a larger audience. So we will use our channels to spread the video, to spread the recordings. So I want to thank you, Elmer. Any last words from you before we start to the closing?
I think the place where we are, the thing what we are doing is great. So we are touching somehow the right way to make a world a better place.
On that note, I really agree. Thank you very much. Thank you for being here. Thank you for sharing your story. Thank you, Silke, as well, for sharing the company of Dot Classes. Thank you, Christine, for kicking off with this presentation. As I said, thank you also all the people in the call. As I said, I think this studio, this setting, actually also these presentations, and definitely these entrepreneurs deserve a larger audience. So we will be sharing this video with our community, so people can kind of tap in and join and reach out to the companies. Otherwise, I hope you enjoyed my first attempt as a talk show host kind setting. I liked it. I really liked everybody here. I liked all the presentations, and I'd like to thank you everyone, including Impact Hub here in Vienna, for hosting us. And with that, I'd like to say goodbye to everybody. Bye-bye.